Really, when we talk about health equity, it's looking at population health and the differences within those populations that really is systemic. It's often socially driven, but the good news is it's preventable. And just the fact that it's being able to be prevented makes it unjust and unfair. And certainly from a public health standpoint, we have a responsibility every day to address and to identify needs and gaps in the community.
To me, health equity is social justice. I think that gender and race plays a very, very important role in our lives, of course. And when those two things are matched and we see disparities apparent in our healthcare system, I think that's an area that needs to be addressed.
Some groups of populations simply just go through disadvantages that other groups don't have to face. So that is health inequality.
It's kind of helping to level that playing field, especially for populations that may have been historically disadvantaged, so that they can have healthier lives.
There's been a lot of moments where I've felt racialized or othered. I think that has been a big inspiration in trying to it's just the simple breaking the barriers and stereotypes that exist.
I think just moving around, especially just my family moved from Brooklyn to Iowa, just seeing that there are definite differences as far as the built environment, as far as education, all of these things have kind of, spurred an interest in me to make those changes if I can.
I'm working with some faculty here in the college to address rural cancer. We're working with towns in Iowa to help identify barriers to access and screening and prevention and try to help get rid of those disparities so that rural towns can be healthier.
So my practicum project right now, I'm working with the Iowa City School District as well as Big Brothers Big Sisters, and just seeing that there are differences in education, differences in healthcare, differences in all of the things that surround underrepresented minorities here in Iowa City. I've learned so much about the issues that are apparent.
I plan on using health equity just by lifting others. It's a passion and goal of mine to see the health of groups, not necessarily from the group that I belong in, but all marginalized groups, to be at its highest. So I'm going to continue in advocating for the health of all individuals.